Hi, everyone. Good evening. Thanks for joining us for day 2 of our speaker series for preparing for a day of truth and reconciliation. My name is Hannah Asprey. I'm the programs manager for the Indigenous Health and Medicine program at Dalhousie University. And we're super excited to be hosting this series of speakers this week, with this year being the first year for the Day of Truth and Reconciliation on September 30th. Just a few housekeepings before we get started. If everyone could please keep their mics muted and their cameras off the portion at the end. We're first going to just start with a land acknowledgement from Dr. Brent Young.
Hi, so I'm Dr. Brent Young. I'm the Academic Director of Indigenous Health for the Faculty of Medicine. So I just wanted to acknowledge the traditional territory where we're situated today, and that's Mi'kmaq, the ancestral and unceded territory of the Mi'kmaq people. And more specifically, today I'm in Bunamagwadi, which is also known as Dartmouth, and it translates, I guess, to salmon place from what I hear. And it was given this name because the Mi'kmaq were known to fish here for salmon, which is a very rich food source. And for me, I sometimes it feels like I'm mourning that type of loss, but after being introduced to the folks that we have in our speaker series tonight and last night, and hearing all of the great positive things that we have going on in Mi'kmaq, I'm actually quite enthusiastic and optimistic for the future. Tonight we don't have Kathy Martin. She's a very popular lady, and she was actually double booked tonight by accident, and we were hoping to do a recording, but we're having a little bit of technical difficulties with that. So I think we'll probably get right into it tonight, unless Hannah, did you have anything else you wanted to say, or?
No, that's great, Brent. I'll just introduce our speakers for this evening and then pass it over to them. So we're very thankful to have two speakers who are going to join forces this evening to give us a presentation around reconciliation. So we have Dr. Margot Latimer. Dr. Latimer is a settler Canadian with a Scottish ancestry and a professor in the School of Nursing, Faculty of Health, and is cross-appointed as the Department of Medicine and cross-appointed in the Department of Medicine in Dalhousie University. Her professional clinical experience has been in child and family care settings prior to transitioning to secondary education and research roles. She holds a CIHR research chair in Indigenous health nursing and a scientific appointment at the IWK Health Center, and is faculty in the IWK Health Center for Pediatric Pain Research. She works closely with the community to mobilize Indigenous knowledge and co-leads the CIHR-funded research Aboriginal Child Hurt and Healing Initiative with the Mi'kmaq Health Director, Sharon Ruderhan. In addition, she is a co-lead on the Indigenous stream of the CIHR Chronic Pain Network, and Margot is married and has 3 young adult children. Joining Margot this evening, we also have Katie Gloade, and Katie is a Mi'kmaq educator and counselor from Millbrook First Nations. She spent 15 years working in the public school system and is now a PhD health candidate in her 3rd year at Dalhousie University. Katie is an assistant professor in the Faculty of Health at Dalhousie and will be teaching cultural safety and healthcare for Indigenous people as a mandatory course for all first-year students entering health professions at Dalhousie. Katie's doctoral research will explore the early education and development from a Mi'kmaq perspective, specifically in the way in which children are assessed for developmental outcomes. So thank you both for being here with us this evening, and I'm going to turn it over to both of you. Thanks.
Well, thank you very much. It's really an honor to be invited. I think really carefully about the invitations or accepting invitations, and as a non-Indigenous person taking up space with my voice. And so I really appreciate that and am honored to have the opportunity to share the work that our team is doing. And so that's really what I'll be sharing tonight, is that the work that has been gathering over the last 15 years that I've been involved. And I do also want to honor the territory of the Mi'kmaq people and recognize the privileges that I've had and my family have had for being able to live here and raise a family and work here at Dalhousie and the IWK before that. So it's really important to talk about our place and our relationship with the land and our relationship with the Mi'kmaq people from my perspective and living here in Mi'kma'ki and recognizing that. And I was asked to talk about reconciliation and, my impression of reconciliation and my relationship with it. And I can only show you, I think, through the work that we've been doing with communities, what that looks like. And, first of all, I guess this was something that was on my Facebook recently, and it kind of struck me. It says, it looks like you're attempting to jump to the healing, reconciliation, and unity without passing through accountability and consequences. So, it's like a computer error, which are common. Please go back and finish accountability and consequences, trying to successfully load healing and reconciliation and unity. So it's really kind of a good flag to think about, how we get ourselves to thinking about reconciliation, because I think there is a anticipation to get to reconciliation as non-Indigenous people. So many people didn't know this history. We weren't taught this history. Many don't understand it, and even fewer understand the impact of the history on Indigenous people's lives, livelihood, health, relationships with non-Indigenous people, non-Indigenous institutions like Dalhousie University, like the IWK, which is my affiliated location. And so I've been really very fortunate to be mentored by elders and very close friends and colleagues who are Mi'kmaq and from other nations. And so it's really something that I've kind of gathered in my own knowledge that I carry with me. So I, of course, went to where this word has originated, the Truth and Reconciliation Commission definition of reconciliation. And the commission says it's about establishing and maintaining a mutually respectful relationship between Indigenous and non-Indigenous peoples in this country. In order for that to happen, there has to be the awareness of the past, an acknowledgement of the harm that has been inflicted, atonement for the causes, and action to change the behavior. And so that's really been the path that I've taken, and that the people that I work with who are non-Indigenous have taken to work with Indigenous people to understand some of that. And so to really understand the hurt through our work, Aboriginal Children's Hurt and Healing, and the atonement for those causes, and then figure out the action to change the behavior. So today's about sharing some of that. The Truth and Reconciliation Commission calls upon those who can affect change within Canadian systems to recognize the value of Indigenous knowledge and healing practices, to collaborate with healers and elders and knowledge keepers, to understand the 94 calls to action and the UNDRIP, the United Nations Declaration of Indigenous Peoples' Rights. These are foundational documents that are really part of understanding reconciliation and all of our roles within that. Also decolonizing practices, including privileging and engaging Indigenous philosophies, beliefs, practices, and values, and counteracting colonialism. And so that's what I see my role in reconciliation being. My role within the university, my role within the health systems, my relationship with governments. I see that role as advocating for and privileging and engaging Indigenous people in those conversations. The way we've done that through research, so I've kind of thought about tonight's knowledge sharing around reconciliation through research. And that's pathway that has been afforded to me through the chair in Indigenous health nursing. And so working with John Syllaboy has just been an amazing experience, along with Elder Albert Marshall. And so we've used this sort of model of two-eyed seeing and kinship, and saying, really putting out front our messaging of communities taking the lead through research and changing health practices. We really try and think about our language, how we title things, how terms can capture people's attention, and we share our messaging, like communities take the lead. It's very clear what our philosophies and what our beliefs are. This is one of the images from our website. Through the work of the chair, we rely on sort of three streams. We have three buckets: research, practice, and education, where we're really trying to create some change. And as I said, we use a two-eyed seeing approach adopted by Elder Albert Marshall and his wife, Mardina. And so, which Elder Albert and Mardina are from the Eskasoni First Nation. They're respected Mi'kmaq elders. And so I thought we'd just share a short clip with Elder Albert, where he is teaching us about the two-eyed seeing approach. So I'm just going to stop sharing, and Dr. Young is going to share that video.
Are you able to see that as a blank white screen, or is it just my background right now?
It's a blank white screen.
Okay, so I'll just press play here.
Two-eyed seeing is very much, in my humble opinion, inherent in the Mi'kmaq way of thinking. I think it's imperative that we apply those lessons learned from our forefathers as to how do we weave back and forth in these two worlds in which we have to coexist without compromising the essence of who we were as a Mi'kmaq.
The sort of Western lens tends to be tactical and data-driven, but we know that people are a whole package of heart and soul and spirituality and beliefs. And so two-eyed seeing combines that in a much more holistic way.
When we look at knowledge around how we understand pain and hurt, for example, we also want to address how we want to learn about healing, what it is about pain management that we know in our own traditions that manage our own well-being.
We need to educate healthcare providers to have a better understanding of the differences in the needs of services and supports that First Nations populations need.
We have to be really focused on what are the needs, the values, the desires and goals of the individual, and that's primary. And secondary is all the things we can do. So I think, the two-eyed seeing model is really about the whole human.
We're trying to bring those two perspectives together, and we've done that through different methods. So, for example, we use healthcare utilization data to look at what First Nation community members seek healthcare for, and do they seek care for the same types of issues, and do they get care for the same types of issues?
And the community was taking part in that process. We're taking part in the training of clinicians, building curriculum, developing health context for understanding what it is that Aboriginal people go through when it comes to health and well-being, understanding the history behind some of the things that would have happened that help us understand who we are today, even when it comes to our well-being.
That co-learning will create transformative change. And that's exactly what we need to move forward with our healthcare system and to support these children and communities to be healthy for the future.
When you invoke your two vaccine for the non-native person, I think it'd be very, very helpful if they can just momentarily put on another lens, so that as this exchange is ongoing, you will be able to then begin to train yourself as to how can I weave back and forth between these two ways of knowing.
All right, is we good to go there?
Great. Just have to re-upload it. I don't know if there's an easier way to do it, but it seems to take me back to redoing it. So, but you can see from that video, it's about being, that was in community. We shot that. It was with community leaders and elders and listening to perspectives and the teachings of how Mi'kmaq people want to be supported in the healthcare system and how we can work with Mi'kmaq people in terms of putting on another lens, putting on the Mi'kmaq lens to think about from their perspective. And that is relational practice. That is considering your own history and considering the history of other people and how that interacts within the healthcare system. Let's skip ahead here. It's also thinking about Indigenous wellness within the balancing of the 4 areas of physical, spiritual, emotional, and mental, and considering a strengths-based approach, a trauma-informed, community-engaged, and a spiritually grounded approach. So all of these are sort of terminology and language ways of describing the work of reconciliation and understanding the history of Indigenous people, but the strengths of Indigenous people and what that means for healthcare. We use various ways through our research to gather knowledge from community. We use artwork. Alan Sillaboy, the Mi'kmaq artist, traveled to several communities throughout the Maritimes and also in Ontario. And this is one piece of art from a youth describing what pain means to them. So I'll just let you read that. We learned through the art-based methods that the information and the artwork that the youth shared is profound. We would never get to these kinds of themes or content just through conversations, but really the visuals tell the story, and then their descriptions of that are quite poignant. This is another one. So in this painting, the eye is a medicine wheel, and that eye, it has a skyline of teepees and trees. It represents the native Aboriginal way of thinking and how we see things, how we connect things to the medicine wheel. And then this eye, you can see the city skyline with smog, and the other pupil is a toonie, and it represents thinking very materialistic ways in the Western world, the Western views, and then the Indigenous views. So she says the Western side, they're pinching her and trying to make her smile and covering her mouth to keep her quiet and wanting her to assimilate into the Western ways. So it's really quite profound the way she sees herself in the world as an Indigenous youth, and the oppression that she experiences. This was another piece of art from a youth, and her painting is about pain. The girl in the painting is thinking about the past, and it makes her feel depressed. and this young person, they painted the feather and how this was a strength and their teaching. So the two sides of the feather, that the teaching was from the elder that they had a choice of which side they wanted their life to be on. So one side was more difficult, and the other side was to follow the teachings from their elders, and that their life would be a healthier life. So I thought I'd just share some of those. It's really fascinating to see that information and to share it with health professionals and help and let them learn from the youth's art and from their own voices, how they're seeing themselves in the world. We also found through healthcare utilization data that there were high rates of pain-related conditions, but low rates of referrals for the most common conditions. Communities talk to us about the need for safe spaces when they come to our health settings and what those safe spaces look like. And so then we turn some of that information around and we create knowledge about what that safe space looks like and some helpful ways that clinicians can create those safe spaces. And so that's part of reconciliation, is listening, learning, listening to the hurt, having community members listen to their own community members' stories and patterns and experiences, and then helping us put that into ways to help clinicians learn from that collective story, that collectivism. And then my role as someone who works within the Western system and has been in the system for quite a while, how do I think about how that could be translated into practice in a way that health professionals would receive it positively and be able to use it? So some of the ways that we've been doing that, as I said, as part of the chair and the work that we do, we have sort of three buckets: practice, education, and research. And these are just some of the ways through our practice, the results of the research on practice. So piloting, we've created an Introduction to Cultural Safety in Healthcare for Indigenous Peoples course that's been running at Dalhousie for several years for all the first year medical, nursing, dentistry, pharmacy, and dental hygiene students. And so the recognition on the part of the university that we need to address the TRC calls to action. One of them is specific to mandating cultural safe information to medical and nursing schools. So we are addressing some of that through this course, and now we're piloting it with clinicians. And again, that's another one of the TRC calls to action. From our research, learning that there are high rates of chronic ear infections, we are piloting ear, nose, and throat clinic in one of the largest Mi'kmaq communities. And so again, that's our reconciliation in action. We're taking that knowledge and putting it right into community, and communities are taking the lead on that. They are designing their own clinic, and the IWK clinicians are working with them in terms of how the community wants that to look. I've got Julie Francis. She's a community health nurse in Eskasoni First Nation and a Master's of Science in Nursing student. She started with the AIC initiative, I think, 12 years ago as a research assistant, and now she's a coordinator, and now she's doing her master's in nursing. And so it's just a kind of a beautiful evolution of a relationship with Julie. She's also been involved in the development and pilot testing of the Kids Hurt app. And so we heard from communities that there's a disconnect in communication about pain and hurt, that community members don't feel heard, they feel dismissed, they have a lot of difficulty describing their pain. There isn't a word for pain in the Mi'kmaq language. And so Sharon Rutherham, who's the co-lead for the AIC initiative, said, well, why don't we, create an app? So that's what we did. We worked with community members. We worked with Dana Sillaboy, who's a nurse practitioner from Eskasoni First Nation, to create an app. It's been translated into Mi'kmaq, And we're now just finishing some of that testing. It's being tested in the Winnipeg Children's Hospital with Indigenous youth there. And so I just thought we could play just a little clip of the video that we are teaching people about it. So let me just stop sharing here. Oh, can you see that?
Are you able to see my screen now?
Yeah.
Okay, and let's see.
So just as it's loading up again, I just wanted to say it's people ask us, well, how do you do this two-eyed seeing? Like, what does that look like? And so the app is a great example of how that kind of plays out, because it is a story. It creates a storyboard at the end, and it also uses the word hurt. We use the pieces of hurt and instead of pain, and we have, instead of using 0 to 10, which community told us was challenging for them to understand, how to attend to one number to their pain, we use pieces of hurt. And in Mi'kmaq, there is a word for hurt. And so we thought, you know, kind of combining some of those pieces is really the two-eyed seeing approach. When we tested some of the icons, we went to the Mi'kmaq Summer Games and just kind of set up in one of the tents. And it was quite fascinating because some of the icons that we had pulled from other established questionnaires. And two of the icons, one was a sharp pencil and one was a dull pencil. And so we would show the youth, for example, the dull pencil and ask them, what did that represent to them? And they had a lot of difficulty getting that. And one of the mums was in the tent as well. And she said, you know, let me have a look at that. So, you know, we were having some discussion about it. And she said, oh, there isn't a word in Mi'kmaq for dull. And she said, we don't use that word. And so I thought that was such a great example of how we take our own Western views or Western understandings and ways of assessing pain, for example, is one thing. and we expect everybody just to understand it, but it doesn't translate into the Mi'kmaq language. And so, of course, we took that one out and found other ways to represent the different types of herd. So that's just kind of one example. We also, through our research, have developed, really good research relationships. We've created information to share with people about how to conduct Indigenous health research through the Chronic Pain Network Indigenous Health Research Advisory Committee, and some of that information's on our AIC website. And we practice that, of course, through our research projects. Through the education arm, we're following the Kazan framework of strategies for nursing education to respond to the calls of action. And Dawn Gugu is a Mi'kmaq nurse and the Onlu nursing lead for the chair, Indigenous Health Nursing Chair. She has a Twitter, Onlu Nursing, if you're interested in following. She's always got something on there. And we're really trying to create a model of support for Indigenous students and a plan of action and key deliverables to create some action around that. And again, that's another one of the calls to action to increase the number of Indigenous health professionals. And so that's really what we're trying to do through the education. You can't just kind of create designated seats. We have to create safe spaces for students to come. We have to have the supports in place to support students for whatever it is that they need. Work with the community to understand the ways to decolonize our curriculum. We're liaising with the other schools of nursing in Nova Scotia to learn about best practices. And so we are sort of taking our own understanding of reconciliation and gathering up the knowledge and sharing it. So what does that look like? It's around decolonizing our spaces and also indigenizing our curriculum through epistemological content, through cultural activities and ceremonies, and also supporting the engagement of Indigenous students and faculty within teaching. We are creating understanding and safe spaces. As I said, we have monthly learning lodges that are led by Indigenous people. We just had a healing lodge today in recognition of the National Day of Truth and Reconciliation. John Silboy will be presenting in October on how to support 2S LGBTQ people in healthcare. And we've had some in the past related to traditional medicine and healing, just as some examples. We are looking at creating a trauma-informed school. And so that's sort of an overall perspective, but within that, it is related to Indigenous peoples and how we can work more respectfully with Indigenous colleagues, students, and communities. Some of the foundational strategies are around creating, as I said, trauma and welcoming environments, partnerships, having institutional respect and spaces for Indigenous students to gather and learn. This is Leah Carrier. She's an Indigenous nurse and PhD student, and her research is around how do we support Indigenous students in the nursing program. Around recruitment and retention, as I said, there's a lot of different ways that we can consider how to do reconciliation through recruitment and retention. And Dawn Gugu is an amazing Mi'kmaq nurse that works within the chair and to try and help figure out how to do this more effectively with communities. And then reconciliation through curriculum strategies by engaging Mi'kmaq faculty, by looking at clinical placements that are Mi'kmaq centered, the Friendship Center, the Healing Our Nations, community-based clinical experiences with Mi'kmaq instructors, and then having content that is related to Mi'kmaq and other Indigenous people, as well as teaching anti-racist strategies and having anti-racist principles as part of our school. So this is Katie Gloade, and I put this up because she is obviously the next speaker, and I wanted to kind of link some of this work together and see how some of this fits together within what Katie will be talking about. And then the last piece for me is around reconciliation through relationship building. And I really see my role and what seems to have happened. It wasn't something I just kind of sat down and went, oh, I think I'm going to do this, this, and this. But what seems to have happened because of my clinical relationship with the IWK and with government and with the relationships that I've developed with community and the university, that I'm able to pull some of those pieces together, introduce people, and help bridge the relationship between what community wants and what we need to be doing within healthcare and education. So thank you so much, Walalia, and I appreciate the opportunity to share this tonight. So Katie, so I'll hand it over to you.
Yeah. Hi, everyone. I'm just going to see if I can get my slides up here. I only have a few. I want to also thank the organizers of this event for inviting me to speak and share in this event. I feel very fortunate with the experiences that I've been having, especially in the past couple of years. It's opened my eyes to the world of Indigenous research in a capacity that I really didn't know existed, coming through a colonial system. And yeah, it's been great. So I want to share a little bit about that. Just need to find my slide here. So a little background about myself and how I came to be positioned in research. I am from Millbrook First Nation, and I did spend my entire career going through the public school system. So I attended public school right through till grade 12. My educational background, I did a Bachelor of Science at St. FX, and then moved on to a Bachelor of Education at Mount St. Vincent, and was fortunate enough to get a role as a teacher in a classroom back in my home high school in Truro. So I've spent my career in the public school system. I did return and do a counseling degree a few years ago. So I've been both a classroom teacher and a counselor. And really, you know, observing the experiences of students in particular that, you know, Indigenous students that have come from community and attending public schools, and their experiences going through the system. My PhD work, I hope to sort of blend a bit of a health perspective with the educational piece. So I do have a passion for counseling, for mental health supports. That is something that interests me, but also education I'm really passionate about, and I've spent a lot of time in that role. And so I needed to find a way to mesh those two worlds together. And I'm very thankful to be involved with some of the work that the Aboriginal Children's Hurt and Healing Initiative is doing with early childhood experiences with pain. And so it makes sense that if children are experiencing pain and they're having issues in early childhood with being diagnosed and treated, how does that play out in an educational system, and how is that affecting their ability to learn? So my PhD research will take a two-eyed seeing approach to engage community, to talk to Mi'kmaq people, to Mi'kmaq educators, families about what they see as school readiness and what is school development, what is development from a Mi'kmaq perspective. And that's something that is missing from the narrative at this point, and missing from the landscape, especially in public school settings. In early childhood, there are assessments that are completed one of them done in the primary year of education, and it measures all children in 5 areas of developmental outcomes. And so these range from physical health and well-being to language and speech to cognitive development and also social. So all of those things are assessed by the primary teacher in the first year of school. And what has come out of that, or those documents, is a bit of research that would indicate from the province that Indigenous children are not scoring as high on all 5 developmental markers as non-Indigenous children. And so when we see that, contextually, we need to think about that and whether it's an accurate portrayal of Indigenous children's abilities. We know that the majority of Mi'kmaq children in Nova Scotia, for example, don't attend public schools. They go to private schools on reserve. So about 80% of the population doesn't attend public school. So there's a bit of a generalization being made about a population that's not wholly represented. So when we start to look at that a little more critically, that's where I'm hoping to take my research. When I first came to the PhD in health, I had experienced a colonial education right through from the very beginning. And through my university career, there were very little opportunities to engage with Indigenous content or courses that related to the Indigenous experience, and in particular Mi'kmaq history, or there were sometimes electives available, but it really depended on your schedule, and it didn't seem to be available. So my experiences with research when I came to the PhD, it was very eye-opening that this world, was expanded for me. And I began to realize that there were many Indigenous scholars, there were many Indigenous people that I could connect with and begin to speak to and talk about their experiences in research as well. And so one of my hopes with what I'm doing in early education and bringing some of this research to the education system is, expanding that experience for children in earlier ages, and, having that representation and having that form of reconciliation from the early years right through to any level of their education. And so research for me is a bit of a challenge because I do understand the negative impacts that research have had on Indigenous communities. It's a bit of a crossroads for me as an Indigenous person to engage in the milestones that need to be done through research and through education, and the expectations that I need to meet, but also be respectful of my culture and my history and my relatives and relations because of those negative experiences. So I hope for my research that I can bridge that gap a little bit and continue with the two-eyed seeing approach, really prioritize the needs of the community, listen to the experiences of, the children and the families and the educators in the education system and what their needs are. And so we have seen some recent shifts in academia. There is a more prevalent Indigenous paradigms in research coming up, which is really excellent to see, especially as someone who's entering into some scholarly works. We're also seeing a shift in that relationality, respect, reciprocity, and responsibility piece. And so these 4 R's are talked about by many scholars, and Margot alluded to these in her discussion as well. So as an Indigenous person and thinking about community, it's how we are connected to each other and our work, how that impacts others. And so it's not an individual experience, it's for the benefit and in recognition of the children that are coming through the education system. And in the case of the pain-related conditions, how are they connected to their community and what are their experiences and how can we make that better? We are also seeing some representation for Indigenous ethics. So there are, in this region in particular, there's Mi'kmaq Ethics Watch. So any research that is pertaining to the Mi'kmaq people, it is good practice to pass your research through the Mi'kmaq Ethics Watch Board and ensure that it is appropriate and that it is abiding by cultural norms and cultural guidelines and protocol, and that it is engaging the community in that research. And so for me, I thought about this, and Margot already touched a little bit on each of these, but when reflecting on the work that I hope to do and the work that I've been engaging in, it's that the research really needs to be situated in the community and guided by the community needs and priorities. Community are the ones that know best about what is required in the community, and the focus really has been on negative deficit-based approaches, especially in education. So when we look at the assessments that I was talking about, we're highlighting the supposed deficits in development for Mi'kmaq children, rather than looking at strengths-based approaches or alternative views or differing perspectives than the Western ways of viewing things. So the community can identify what the needs are, and by engaging community, we can highlight the strengths as well. Research is also really reflexive, and for me, I'm constantly thinking about research and my role in research and who's engaged in it. And so that reflexive practice is something that I encourage a lot of my colleagues to do, both non-Indigenous and Indigenous. So it's, yeah, thinking about what we're doing on a day-to-day basis and who we're impacting and what we want to be the outcome from that. And so that keeps us connected, leading into the third really important point for me is providing an opportunity for relationship building and trust. So research does have that really challenging past, really awful past, sometimes horrific. And so that takes time to build up that trust and relationship between community and others, to know that, you know, research can be beneficial, that it doesn't always have to be a negative experience, and that if research is being done with community in mind, the community can use the research to whichever they feel is important and useful. And lastly, that accountability. I think that is a large piece that has been missing. Even when we think about Truth and Reconciliation Day coming up on Thursday, the accountability piece is still lacking for some, for many. So who is responsible? Who is going to take accountability? And so engaging in good research, engaging in those 4 R's, reciprocity and respect, included who is taking accountability for this research. And so that also builds trust through that process as well. And so these are things that I'm trying to be mindful of as I move forward. So early education from a Mi'kmaq perspective, I already talked about this a little bit. So this slide just sums up my research. What I hope to do. And so that talks a little bit about the prevalence of chronic pain conditions that are less likely to be diagnosed, treated, and referred. And so that definitely would have an impact on children's ability to learn. Yeah, and so the action piece. So where do we go from here? So the impact of research needs to have an action piece, and that's a huge component to reconciliation in my mind. Especially in the early years and when we're dealing with outcomes for children. So a healthy trajectory for life does not happen unless we look at the structural determinants of health, and including addressing racism through anti-racist policy and practices. Again, that hugely relies on anti-racist practices. And so throughout the education system, providing people with skills and building trust in confronting racism when they see it, and providing accountability pieces for people in the education system is really important. Providing and implementing universal and quality early childhood programming, and collaborating with Indigenous communities and respecting cultural protocols when doing this, and engaging in research going forward. And so two-eyed seeing is a really wonderful approach, and this is something that I will be using moving forward and encourage others to be reflective about. It asks us to consider whether a current way of doing things can be done better, and it's for the benefit of all. And Elder Albert talked about that in the video. It's how do we flow from one way of knowing to another, and by doing that, it represents Indigenous knowledges and makes them not a sideline that prioritizes colonial ways of doing things, and for Indigenous students really looking at Indigenous ways of knowing, and then they can see themselves in the classroom, they see themselves in the research and moving forward. Two-eyed seeing helps to shape the changing of terminology used in the interpretation of assessments, especially in early childhood. And it supports the recovery from cultural starvation. So we do see a lack of culture in many of our schools and many of our classrooms, especially when we don't have, if we don't have large Indigenous populations in those areas. It's easy for schools to navigate away from that and navigate away from incorporating culture into those programming. And recognition that children are growing up with conflicting ways of knowing and being. And so that's what I was just highlighting about having those two ways of knowing and really prioritizing that two-eyed seeing is beneficial for all, and that Indigenous ways of knowing have been around since time immemorial, and they are important to prioritize. So I'll stop presenting there. And yeah, I think we would maybe open it up to questions, but I'll hand it back over to Hannah, and yeah, thank you.
Yeah, absolutely. Thank you both so much for sharing and sharing your personal experiences as well through research and working towards reconciliation. So we definitely have time for questions. So if people could just use the raise your hand function on Teams, we can definitely take some questions now for Margot or Katie. You can also write in the chat if you don't feel comfortable. Brent?
Yeah, I figure I might as well chime in here and ask a question. Katie, I was just wondering, like, you have a pretty unique perspective on things where you've been kind of through the like education system at the, I guess, like at the public school level. And I'm just wondering, like, if you could kind of speak more to how you see these pathway programs developing over time in terms of bringing more Indigenous folks into health professions, other like types of professions, and if there's a way that we can like better work with community to identify like who are the all-stars in community who really are like interested in these areas, and how can we support those students wherever they're at in that journey. Just wondering if you had any other words to say about that.
Yeah, absolutely. And so, as I said, my experience has really been at the high school level, or maybe I didn't say that, but my career has been at the high school level, both in the classroom and counseling. So I have seen the experiences, and we do have a large Indigenous population in our school. We do neighbor Millbrook First Nation, so there is no school on reserve, and so the students do attend our high school. And so I have seen just anecdotally some of the outcomes for students that would have gone through early elementary and maybe through assessments, maybe have been misdiagnosed or perhaps labeled through early education and then come through high school. And high school really impacts post-secondary, as we know, with the choices that you take in high school for courses and what you can take. And so that's shifting a little bit. I am seeing some changes from the Department of Education down in opening up, doing away with prerequisites and allowing students to be able to take whichever courses they want in high school. But part of my passion for moving into early education is because, some of these issues that we see arise and limitations on people's options for post-secondary really can be countered in early education. And so if we are assessing children in their early years, especially in grade primary, that can really change the trajectory of programming through their entire early elementary and then subsequently high school. So my hope is that if we look at the assessments and we're looking at Mi'kmaq children and the ways in which they demonstrate social knowledge and the ways in which they demonstrate language competencies, that these aren't deficits and that they know things in different ways, perhaps, and that those strengths really need to be highlighted. And I think that those interventions in early education will sort out some of the problems that we're seeing in the high school level. And absolutely, I think if we get more representation in the high school classrooms, even if we have some people come into the schools in the grade 10 year or grade 9 year and talk about the different pathways, I think people, and I do a lot of my role in the counseling office advocating for different programming, and people think that if they don't take a particular course, that's shut off for the rest of their post-secondary career. And that's just not factual. I mean, it's not a linear road to get to a career that you might desire. There's many ways to get there and navigate it. And so I do a lot of that problem solving and sort of talking about the courses that they can take. So yeah, even junior high would be really helpful to get some people from community that are in these positions and into the schools and talking about what we're doing. And as I said, my career was spent through the public school, and even right through university, there were no Indigenous mentors in the programs I was taking or even courses to take. So the expansion of that, it helps a lot. It's huge to have representation.
Awesome, thanks.
Thanks, Katie. Margot, I just had a quick question for you, and then I see David has his hand up as well. For folks that are just getting started with research, I know that you've built a great relationship with the Mi'kmaq communities, but is there one or two things that you can suggest to kind of start that relationship building and how you did that when you started?
I think just learning the history of the communities that you may want to work with or may have something to offer, and understanding that history, what's important to the communities, what their goals are, what the priorities are, offering your knowledge and abilities for the community's use. And I think one of the sort of tensions, it's not a tension for me, but one of the pieces that I think when you're trained as a researcher is that you're trained to look at your research as your own intellectual property, and that you have full control over that. And so you have to recognize that first, that working with Indigenous communities, it's not about you. It's not about, the whole sort of academic pathway is about the researcher and the academic and how important, that person's career trajectory is and publications. But working with communities, the knowledge is owned by community. It's in service, the work and the research is in service to community. And so, you know, understanding what your role is a first step. Learning about the communities and offering, you know, your own knowledge and abilities is and in a sincere and authentic way, I think is important.
Great, thank you. Dr. Anderson, did you have a question?
Thanks, Hannah. So first of all, thanks to you both for your presentations this evening. Really enlightening and helpful about learning about reconciliation through research. I do have a question that really is quite similar to or builds upon what Hannah asked. But I think part of the truth around research in Indigenous people that you both spoke to are some of the horrors of how poorly and really terribly Indigenous people were managed in research done by colonial peoples, and how it to me it is admirable how that Indigenous research has now, you know, really become so sophisticated and so focused on value to the community, as you know, I think, as you've said, Margot, as the premise here, and I just wonder if you could. You know, if you could speak to really some of the things that you think for Indigenous research that really is being done very well and really, you know, makes a difference in a positive way, and really some lessons that people that are doing traditional sort of Western research really could learn from the approaches that you have taken in your Indigenous research. Just be interested in your comments and your perspectives on that. But thank you so much for speaking this evening.
Yeah. So I think when you read chapter 9, the guidelines of conducting research with Indigenous peoples, you know, one of the very first sentences is that it has to benefit Indigenous people. The research has to benefit Indigenous people. And so there's no way that I would know that unless Indigenous people were leading the research and involved with developing the research question. And so obviously, I'm not Indigenous. I have, you know, come from my own perspective and have learned through a Western system. So what I think may benefit Indigenous people may not be right, or what Indigenous people think will benefit Indigenous people. And so that is really kind of full stop the baseline understanding of all the work I think that we do is never ever starting a project or discussing, you know, a project without Indigenous people at the table saying this will be of benefit to them. And so, and from there on, it flows. And so that's sort of one foundational approach that is a must, I guess I have to say. And so engaging community at the first point of the question. And so I remember, for example, a RIM student contacted me a number of years ago and wanted to look at, you know, surgery rates or something for Indigenous youth for a particular condition that non-Indigenous RIM student was interested in. And so I said, okay, well, let me ask the community. So I went to one of the community leaders that I work with, and I said, is this an area of interest for you? You know, there's a research and medicine student from Dalhousie who is interested in this topic and could do a project on it if it was something of interest. And she said, no, that's not of interest. So I had to go back to the student and say, I'm sorry, that's not of interest. It's not a priority for the communities right now. And you can appreciate many people want to do Indigenous health research. It's of interest, but that's not, it's up to the community to decide what's of interest and what might be of benefit to them. And so engaging the community early, they're overwhelmed with questions about types of research that people want to do that they think will benefit them. But we have a history in Canada of non-Indigenous people making decisions for Indigenous people about what they think will benefit Indigenous people. And so that has not worked out very well. So, as a baseline, those are some of my advice. That's some of my advice is engage the community early to determine what is of benefit to them, include them in the development of the question, the methods, the assessment, collecting the information and interpreting, synthesizing, and disseminating it. And so those are just key pieces that the community needs to be involved in at every step of the way. I hope that answers your question, David.
Yes, thank you very much.
Thanks, Margot. Lynette, did you have a question?
Yeah, thanks, Hannah, and great to hear your presentations, Margot and Katie. My question might already have been partly addressed by your answer, Dean Anderson, but I guess I wanted to ask you if you were in charge, say, of the nursing school or the medical school or another health profession school, and you wanted to do something really substantial and impactful at this point in time to make a difference to our future capacity for health research, serving Indigenous populations and engaging with Indigenous groups, what would you do with some of the pressures you've talked about? I mean, I know Margot can't mentor everyone, and communities don't want all research, and we can't just ask Brent to do everything because he's new to faculty and we burn him out. So what would be the most important thing we could do now in the next few years to make a difference?
Katie, do you have an answer? I can answer some of that, but do you have any answers?
Well, I can't necessarily speak about the faculty and the programming that way, but I think expanding, building on what we're doing. So expanding on the cultural safety training, the anti-racist training, the health professionals that are coming through the programs, those are going to be the future people who are treating and interacting and potentially going into community or serving the populations. And so the more impact that we can have on those early experiences in their education and maybe change that trajectory of their education and their thoughts and their interactions with Indigenous people, the more positive outcomes there will be on the other side of that. And again, it comes down through the education system right down to the early years. And so we need to make changes in the whole education system. And just our views of what knowledge is valued and what we prioritize as valid ways of knowing and being. And so as we shift a little bit more into having Indigenous voices being heard, just, really sort of taking a moment to listen and process that. And I know engaging with some of my colleagues, sometimes we've had these open discussions and just anecdotally speaking, that it's challenging from a non-Indigenous perspective. They want to be able to do something about it right away, rather than actually listening and self-reflecting about it. And so I think that processing piece helps too in the education. But yeah.
And I think there's we're actually doing it through the work that we're doing. You can see all of the Indigenous students that are kind of coming through the program you're right, I can't mentor all of them, but really creating space to be able to do that, and resources and support, but also our policies, having leadership, Dalhousie leadership directors, etc., associate deans, be willing to be nimble in changing policies that are create barriers for students. For example, one of the students from one of the communities who's doing a thesis-based master's, so the community has asked us to sign an agreement, a contract with that community for that student's research. And that's new, but it's makes sense that we are entering into a contract because that research is community owned, and they want to ensure the safeguards around that student's research. And so as a result of the OCAP principles, ownership, control, access, possession, the community owns that information. And so, but in order to graduate with a thesis or a dissertation from Dalhousie, you have to post your thesis and dissertation in the public domain on the repository. And so you can't graduate until that happens, or you're not considered convocated. And so, but that's in conflict with the OCAP principles, for example, because Dalhousie doesn't own that information to be able to disseminate that or share it. And so the community may not want some of that content shared. And so we worked with Faculty of Graduate Studies, Dr. Leonard, who's amazing leader and very nimble, and said, you know, this is a problem. We never really thought about this before. How can we provide these assurances to the community that they don't, that we're not going to post this information publicly and the student can still graduate? And so we've been working on that contract and putting in some safeguards before that student graduates to be able to say that's okay. You don't have to do that. And then looking at it, you know, going to Senate and trying to make those changes for just that one little piece. This is one little policy. But you don't think about all of those pieces. So those are some of the ways that the university can be helpful, that when these arise, that instead of saying, no, that's the way we've always done these things, that you say, okay, how can we change that? Because the university is incredibly challenging to change policies and practices. But if people recognize the sort of fundamental reasons why we're requesting that and help us create those changes, then that will go a long way in creating safe spaces, welcoming spaces, and allowing us to honor some of those relationships that we have with through research, but also with communities, and respect and trust.
Thanks so much, Margot and Katie. Brent, did you have another question?
Mainly just a comment, because Lynette had mentioned my name there, but I think like they're kind of going back to some of the challenges that we face as Indigenous people in healthcare in this province. Like there aren't very many of us, and it's getting to be like we all start to know each other, and that's great because we can collaborate on a lot of these initiatives. But the biggest challenge that I see is that, I mean, number one, I don't have 12 more hours in my day to do all of this stuff. Like that would be fantastic. But the way that we're actually organized is like we're spread very, very thin when there's so few of us. And so there are various people working on different initiatives in different departments and different faculties, and not necessarily kind of coming together to form like a cohesive center for excellence, like you would have at other universities, and looking at the things that we can achieve when there are more of us working together with kind of common goals and whatnot. Like myself and Hannah and the rest of the team in Indigenous Health and Medicine, like now that there's 4 of us and most of us working part-time, like we can actually do some great things, like put on the speaker series in extremely short notice and find like actual great speakers for it. And I think all of those things, like I think we can do a better job of bringing ourselves together and kind of collaborating in a better way. But I think there needs to be some kind of, there needs to be some sort of change from a leadership perspective in thinking about like how are we being strategic in the way that we're actually deploying like our Indigenous human resources essentially when they're so limited at this point in time. And then of course there are the other things that we always think about, like that we need to work on in terms of admissions and increasing the recruitment and retention of Indigenous folks into all of these different health professions as well. But that's just my 2 cents on it.
Thanks so much. Do we have any more last minute questions for our guests this evening? Well, I just wanted to thank you, Margot and Katie, again for joining us and talking about these really important topics. And I think one thing that we can all take away is we're all on this reconciliation journey together, and we might not all be starting at the starting line together, but we're all working towards the finish line. So no matter where we're at in the reconciliation journey that we're on, we're all working to this common goal. So I really appreciate you both sharing your experiences and giving advice to everyone here this evening on how we can work towards reconciliation, especially with our research. So thank you so much. We really appreciate it. And I think that will conclude our events for this evening.
Thank you for having me.
Yeah, thank you very much.
Thank you.
Thanks, Katie and Margot.